I'm delighted to welcome all of you. My name is Sue Stepleton. I direct the Policy Forum at the Brown School at Washington University. But this morning, I'm wearing the hat of chair of the local council that will oversee the work of Project Launch. And I am thrilled to be in that position. Many, many people have been working very hard to have the success that we are announcing today and celebrating today. And many of the efforts, it's important to note, there have been efforts around strengthening early childhood in St. Louis for 40 years, 10 years, 20 years, 30 years, 40 years, at least that. And there has been progress made, but we need more. And this grant would not have happened. This grant, let me go ahead and speak these words, $4.2 million to be. And this, while the target of this grant is the 06 and 07 zip code area, there will be spillover into other areas in the metropolitan area, into other parts of the state. This is a federal project, so there will be learning back and forth, reciprocal learning across all levels. It's a new relationship between levels of government and learning among those levels of government.
Well, again, thank you for allowing me here to be part of your celebration. We're very excited about this. This really has been a culmination of years of work and dedication from many of you in this room who have been advocating for early childhood and know the importance of early childhood in our children's futures, both in preparing for school and for life beyond as an adult. The Project Launch, which stands for Linking Unmet Action for Children's Health, I always stumble on it a little bit, that's why I like launch, creates very intentional linkages between the state and local entities, creating partnerships to enhance and build upon what has already existed. In particular, I'd like to thank Dr. Lane Youngwalker, who is not able to be with us today. She is the principal investigator for Project Launch. She also is the principal investigator for the Boone County Launch grant, which was received 3 years ago by the Missouri University Psychiatric Center. Also glad to know that the Department of Mental Health is partnering with the Department of Health and Senior Services in focusing on a holistic view of health in both behavioral health and physical health. This is closely tied to many other state initiatives which bring together early childhood champions, including the Early Childhood Comprehensive System and the Maternal and Infant and Early Childhood Home Visitation Program. So there are lots of ties both from the federal level to the state, and now we want to make strong ties between the state and the local level. It was pretty easy to pick St. Louis as the local pilot site for this project because of the work that had been done locally for so many years through the Regional Early Childhood Council, headed up by Elizabeth George, Vision for Children at Risk, thanks to Rich Patton. They have been wonderful partners in this, both in helping us make the application, which was successful, and in kicking off launch here locally in St. Louis. We have many players at the local council I hope you will get to meet. I also would like to thank Ed Tash from, where is Ed? Ed, right there, from National Council for Alcohol and Drug Abuse, who will be a key player in this, bringing together with us a focus on prevention in substance use for our children and families. So Launch has many goals and objectives, and I want to share a couple of those with you real briefly today, and hopefully you'll take the time to learn more about them as we continue on. The main overarching goal is for all children to reach social, emotional, behavioral, physical, and cognitive milestones in their development to lay the foundation for school success and success as an adult. Through that end, we are focusing on several different areas, including increased access to screening, assessments, and appropriate referrals for early childhood individuals and their families, expanded use of culturally relevant and evidence-based prevention and wellness practices in a variety of settings, Integration of physical and behavioral health. We're happy to partner with our physical health partners here, such as the FQHC at Grace Hills, BJC Health. Increased coordination and collaboration across all systems, and increased workforce knowledge of, on children's social and emotional development. So I'm very excited to join in this celebration. Couldn't have done it without your local partners here. You should be very proud of yourself, and I look immensely forward to working with each and one of you in making our goals and objectives for our children and family come true. Thank you.
Thank you, Sue, and good morning to everyone. You know, first of all, to Roderick Jones and people at Head Start and Grace Hill, thank you for your great leadership and all you do for young children and families in St. Louis. We're very proud of the organization, and thank you for hosting this as well. To Patsy Carter and the Mental Health Department of the state of Missouri, thank you so much for not only your interest in children, your support of things that we are doing for children, and for your agreement to partner with the Regional Early Childhood Council and Rich Patton at Vision for Children at Risk and others to for this particular grant, and to really help us with our efforts to improve the quality of life and opportunities for children in St. Louis. And to everybody in this room, all of you in some way are responsible for the grant being given to this to St. Louis, and all of you will be involved in helping make sure that we are successful with the grant opportunities that's presented. I do want to recognize Robin Wabi from my staff, who without whom we couldn't do all we're doing in city government. She does really do a great job in working with the various partners, because that's what this is all about, and steering me as mayor in the right direction in terms of what we need to be doing in a whole different number of settings to help and support children and families in St. Louis. I want to thank Dr. Sue Stepleton for her willingness to lead the Regional Early Childhood Council, which will oversee Project Launch. Her commitment to children, of course, is unparalleled, and I'm grateful to you and Washington University for your participation and leadership. Of course, all of us in this room know that every childhood matters, and you know what the opportunities that we provide for children really says a lot about what we are as a community and where we are going in the future. No matter what their income level, their race, their ethnicity, where they live in the city, it's important that all of us share the responsibility to help all children reach their full potential. That's why this grant is so very important, and it is substantial too. This is not a little bit amount of money over a short period of time. We're talking about $4.2 million over a 5-year period. It will help children predominantly in 2 zip codes, one of which we're in today, where life is hard. They have some of the highest concentrations of poverty and crime, and the lowest economic outcomes of children in the city of St. Louis, and academic outcomes for children in the city of St. Louis. These zip codes are also among the areas with the highest percentage of young children in the city of St. Louis. Without our attention, the combination of high needs and high density is nothing short of a recipe for persistent social, economic, and health devastation. This grant is coming to St. Louis because of all of you and the agencies you represent. They know what I know, and you are doing a terrific job. We've seen much progress in early childhood efforts over the past decade. The number of kids participating in Parents as Teachers has doubled, and we'd certainly like to see that increase even more. The summits we held on early childhood education have resulted in more and better child care for working families. Last year, St. Louis Public Schools, in partnership with the NAACP, American Federation of Teachers, and others, dramatically expanded opportunities for preschool. I want to thank Dr. Kelvin Adams, Superintendent of St. Louis Public Schools, and Dr. Shell Davenport, Executive Director of Early Childhood for the district, for their division and for their leadership. Perhaps one of the most significant early childhood partnerships thus far that had a real measurable impact on children is the Lead Safe St. Louis. Many of you were involved in that as well. Not long ago, more than 20% of tested children tested positive for high levels of lead in their blood. lead poisoning in the city is now under 3%, which is a tremendous amount of progress. And this month there will be a groundbreaking of a state-of-the-art early childhood facility center in Murphy Park neighborhood. It will be called the Flant Center. Without a doubt, the lives of children in the city of St. Louis are better because of all the work that we've all been doing together. But as we all know, there's still a heck of a lot of work to do. Too many of our children still live in poverty. Too many of our children lack basic medical care. Too many of our children go to substandard schools. Project Launch is an important next step for all the work we've been doing. When we succeed, more children will be healthier, better educated, and better able to live a long, productive life. And I can't think of anything more that we can be proud of than that. I certainly look forward to hearing about our progress at future commission meetings for our Commission for Children, Youth, and Families, which many of you not only belong to, but attend on a regular basis. And I look forward to more opportunities to work with the state of Missouri and all of you to improve the lives of our youngest citizens. Thank you so much, and we're very, very thrilled with this. And we will make sure it will be successful.